Good morning and welcome to the UNLV Center for Business and Economic Research Mid-Year Outlook. My name is Andrew Woods and I am recently the new director, joined Lee Business School as the director of CBER. I'm honored to be leading this esteemed organization during an exciting but nonetheless challenging time for our state. I want to thank Dr. Stephen Miller for his steadfast leadership over the past 6 years as director. I'm thrilled to announce he'll be staying on to manage research on behalf of CBER, and I will be leaning on him for his expertise as we move forward. For 45 years, CBER has been the premier research center for Southern Nevada in business and government. Over time, CBER's mission and role has expanded to not only help our community leaders, but also the broader public on issues as far-reaching as Nevada's Kids Count Project, to the Clark County population forecast, leading tourism indexes, and even a study on Nevada's desert tortoise population. Today, you'll hear more about UNLV's role as a public resource as Nevada's own Dr. Fauci, Dr. Brian Labus, epidemiologist and assistant professor at UNLV School of Public Health, discusses ongoing challenges of the pandemic and what we can expect in the months ahead. Afterwards, Nevada's own Jerome Powell, Professor Stephen Miller, will give an economic update and forecast for the state, the broader U.S. economy over the next several years. Several of you have already submitted questions in advance, and viewers currently watching will have a chance to submit questions as well. Before we get started, a few words from me. The past year and a half have been a time of great change for the world, our country, and our state. Southern Nevada is no longer just the world's favorite getaway, but has also evolved into a thriving and vibrant community of 2.4 million people from all walks of life. I know all of you are playing a role in our success, from our hospitality workers to our small business owners, healthcare professionals, and educators. What we all have in common is every one of us calls this place home. Twice in the past 11 years, we have suffered severe recessions, one man-made and another created by Mother Nature. They have affected us deeper and longer than the rest of the country. As we emerge from the worst of the pandemic, our businesses, our workforce, and our community are turning a chapter and using the lessons learned to adapt and succeed under changing conditions. Here at CBER, a chapter has been changed too. As the director, I'm working with my esteemed colleagues in the business school, such as John Osborne, and with the support of our new dean, Dr. Jerry Sanders, to do more. We realize at CBER we need to play a bigger role in helping our leaders build a stronger, more resilient, and dynamic Southern Nevada. This change is reflected not just at CBER, but at the Lee Business School and UNLV. UNLV was recently designated with the Elite R1 Carnegie Research Classification, the youngest university in the country to achieve such a classification and one of the most diverse. Lee, under our dean, is leading the charge to expand our executive education programs, offer more online courses, and connect with our alumni who are transforming business not just here in Las Vegas, but across the world. Here are just a few short examples of how the same tools we employ at CBER are used right here in our backyard and around the world, because we are building a better tomorrow today. What do Amazon, the city of Chicago, and healthcare all have in common? All three are ever more reliant on analytical and economic principles to make real-time decisions. In the case of Amazon, they used descriptive analytics during the pandemic to ensure their stores were stocked with goods and materials, like cleaning supplies, while others struggled to keep up. In Chicago, the city uses predictive models along with supply and demand to predict rat infestations with partnerships in universities and the private sector. It has worked so well that reported rat sightings has decreased 20%, and the program has been expanded to include prediction of possible health outbreaks at restaurants. In healthcare, hospitals and government can now tie real-time traffic information to predict upticks in road accidents and respond to hospitalizations. Just think how we could be helping you. Ongoing research by our Department of Economics with the UNLV School of Public Health found that 28% of senior citizens in Clark County identified as food insecure, and that information and information sense has helped on-the-ground local organizations like 3 Square focus on where resources are needed the most. In addition, groundbreaking research by our faculty is also shedding light on the relationships between climate change and wildfires, access to health care, shifts in Nevada's growing workforce, and even water usage during the pandemic. We know you have a choice, but when you work with CBER, not only will you be working with Nevada's premier economic research center and faculty, you'll also be supporting a wide array of Nevada's best and brightest students. Here are just a couple of examples. CBER's graduate research assistant, Mint, recently completed a paper on market forces behind price differentials in specific commodity markets and the impact of export bans. She is continuing on her research at Stanford as a pre-doctoral research fellow in international development. We wish her well. Katie Gilbertson, a junior majoring in economics and researcher at Brookings Mountain West, recently penned a column in our local newspaper suggesting 6 fixes to DETR, not by reinventing the wheel, but by looking at best practices in other states and even other countries. Speaking of Brookings Mountain West, we recently heard the news of Dr. Robert Lang's passing. Dr. Lang was a champion for the Urban Affairs College, UNLV, Las Vegas, and our state. He is deeply missed and leaves behind big shoes to fill. It's clear the road going forward is not going to be easy, but the $2.7 billion from the American Rescue Plan provides Nevada with a once-in-a-lifetime opportunity to invest in our people. The fact that many of our most vulnerable populations did not have access to broadband in the midst of the pandemic highlights the need for in-depth information on who does and does not have high-speed internet. Diversification of our economy means interpreting what is needed to bring new businesses to our state and grow the ones we already have, such as in light manufacturing, bioscience, engineering, and infrastructure. These are just some of the examples of how CBER, with our partners at the Lee Business School and UNLV, are ready to do more, be more, and say more when answering the call to action on behalf of the public and our clients like you. That's because we all know ideas can change the world, but it takes a rebel to make it happen. It is with this that I'm excited to be taking the helm of CBER and help Nevada write the next chapter of our history. Now, I have the pleasure of introducing Dr. Brian Labus, an infectious disease epidemiologist and assistant professor at the UNLV School of Public Health. His research interests include outbreak investigation, disease surveillance, the use of social media to detect and investigate health problems in the community. Prior to joining UNLV in 2015, he spent 15 years at the Southern Nevada Health District as the senior epidemiologist. In March, he was appointed to Governor Sisolak's COVID-19 medical advisory team, and he currently oversees a team of nearly 200 student contact tracers at UNLV. He is here to talk about our health and our economy are tied at the hip and what we can expect going forward. Thank you, Doctor, for being here today.
Thanks for having me. What I'd like to talk about today is the data behind COVID. How do we look at those numbers and what do they mean? It's a little different than looking at economic data, so I want to start by talking about the different types of data that we have and which ones actually mean something. So how do we look at all this data that's been coming in over the past year and a half? We see it in the newspaper every day, you see it on TV. It can be very misleading though if you don't understand where that information is coming from and what it actually means. So there are a number of different things that we need to think about, and starting is the infectious disease itself. Everything that we look at has a time delay in it because it takes time from when a person's infected until when we have that information about what happened to them. So the incubation period of the disease is somewhere between 2 and 14 days. So right there, just from infection to the first indication that somebody's sick, puts us at a delay of typically at least a week. So from a person getting sick to ultimately having disease is on average about 5 or 6 days, but it can be 2 weeks. So right there, whatever we look at today does not show us today's risk, it shows us what happened a couple weeks ago. After that, it takes a little bit of time for someone to seek care. It depends on how quickly the illness progresses. Some people don't seek care at all. Others wind up having a very severe disease and seek care within a few days of that initial infection. But again, that takes time after the disease has started. Beyond that, we have to conduct a test. And the PCR testing can take 1 to 3 days to get results back in. When we had the really big peak of the outbreak at the end of last year, it was taking much, much longer because the system was so overwhelmed with testing that it took 3 days to get results back. So that adds to that delay as well. So just with that alone, from the time a person's infected until we know about it, could be 3 to 4 weeks. Beyond that, if somebody has a serious disease, they wind up going into the hospital. It takes time for the disease to progress to that point. And unfortunately, if that person dies, it takes time for that to occur as well. So if we're looking at something like deaths, we could be a month after their initial infection or more. So anything that we're looking at with deaths doesn't show us what's happening today. It talks about the risk to that person a month ago. Now, on top of all that, this is just the natural process of disease occurring. We have to think about how the information moves from the medical system to the public health system. So all those reports of laboratory testing, hospitalization, and the deaths wind up making their way into our disease surveillance systems. With testing, there's an automated process that the labs send the information in rather quickly. For something like a death, it takes time for the coroner to investigate, to have a death certificate, to have an investigation to determine if it actually is a death. So it has to be reported to the health department. And then there's the investigative process on the side of public health. For some things it's faster, for others it's longer. all of these add to a delay in really understanding what's going on. So if we talk about how many cases were reported by the health department today, it doesn't tell us what's happening today. It really tells us what happened at the beginning of the month. So any of the data that you're seeing in the news right now are things that happened basically starting at Memorial Day and into the beginning of June when we reopened Southern Nevada at 100%. So right now we're starting to see the effects of all those reopenings, and we've seen a little blip in our numbers over the past few days, which may or may not anything, but I'll come back to that. So there are a number of different data points that we look at to try to understand what is happening with the pandemic, including positive test results, the number of tests being ordered, our positivity rate, hospitalization and death, and then the demographic information tied to each of those people. Now, when it comes to laboratory positives, we report those every day. Here's how many people we receive positive test results for. This is the chart from the Southern Nevada Health District looking at when the person reported the onset of their disease. So even though we have the laboratory positive, we have to find out when that person got sick. It's not the date they were tested. We're interested when that illness actually occurred. And so it takes time to get that information. And we wind up looking at charts like this. And as you can see, there's quite a difference from the beginning of the pandemic to the later stages in November and December of last year. Now, unfortunately, this is just laboratory positives. This doesn't tell us anything about the severity of the disease because early in the pandemic, we didn't have the ability to conduct much testing for it. So the spike that you see in March or April of 2020 seems really low compared to what happened later, but that's because most of the people who were positive were not actually tested. So this data, looking at the absolute number of positive test results, can be very misleading because it's dependent on our ability to test and people being willing to go and get tested. Now, when it comes to those positive tests, we have to think about how many tests have actually been ordered. This is a chart from the state looking at the number of tests that were ordered, a 14-day moving average. And we do that because we have to smooth out the numbers on this. Test ordering changes day by day. I have another chart later. I'll talk about that a little more. But as we see us move through the pandemic, things change. If there's a holiday, testing drops off. If there's some other big event in the community and everybody's scared, testing increases, and that's going to drive these numbers. So we have different number of people being tested every single day. And as you can see for this pandemic, early on we weren't conducting that many tests because we just didn't have that capacity in our community. It took us until last summer to have that available to us. So the early parts of the pandemic, we were only testing people who were hospitalized or had very serious disease, and then we could open up to more and more people. And so the people that are being tested actually changed over the course of the pandemic. So early on, the positives, the tests ordered represent the sickest people. Later on, they represent everybody who wanted to get a test, including people who have been exposed and don't have disease yet. So when we put those together, we get the positivity rate, which is the thing that tells us probably the best way of what's going on in this pandemic. So if we look at this chart, we can see that initial number of positive tests that we talked about in March of 2020 was really low, but the positivity rate was really high. We reached between 15 and 20% in that peak. We were over 20% in the third peak of the pandemic in the latter part of 2021. And now you can see where we're at, where our numbers are much, much lower, down near around 5%. This really tells us where things are going. Now keep in mind, there's also this delay. We're trying to understand when people are sick, but this is based on the lab collection date. It's not the date they were actually exposed. There's going to be a couple-week delay in this particular data. So if we saw a spike on the first of the month, it meant the actual exposures occurred about 2 weeks before that. So that's something we have to keep in mind all the time. Everything in here is a bit delayed. Now this is a chart just on the total number of tests ordered, but I wanted to show you this because if you look at the gray bars behind the chart there, you can see that they kind of spike and decrease from day to day. And this is why it's very challenging to look at single day changes day over day when it comes to this type of laboratory result. If there's a big spike one day and a big drop off the next day, it really doesn't mean that much. You kind of have to step back and take a look at the broader trends because you can see exactly what's going on here. And we see these weekly patterns where Monday has the biggest spike in testing because over the weekend people stayed home, and then when they had to go to work on Monday, they weren't feeling well, they were getting worse, they went in and got tested. We see this all the time. This is nothing unique to COVID. We see it for influenza, we see it for other things. If people are sick, they're going to stay home over the weekend, go into test on Monday, and then we see a decrease over the week. And then big holidays, we see a drop off as well. Christmas, Thanksgiving, things like that. People don't seek care on those days. They put it off to the next day, and we see a corresponding spike the next day. It doesn't mean anything though, because it's just a shift shift in the way people actually seek care. So we have to keep that in mind when we look at all of these results. And that's why those day-over-day changes aren't important to look at. It's really important to take a step back and look at the long-term trends of what's going on, and why we typically present this data as 7 or 14-day moving averages, just to help smooth out those differences that we see just to human behavior. Now, another thing that gets a lot of attention is the hospitalizations. Hospitalizations don't tell us a lot about what's happening with the pandemic right now because there's the delay, and it depends on who's actually being infected. So if we have a lot of older people being infected, we're going to see more hospitalizations. If we have younger people, we're going to see fewer hospitalizations. It doesn't tell us anything about the risk. The reason we look at hospitalizations is to understand the burden on our healthcare system. This is what hospitalizations look like over the course of the pandemic. The dark gray are the confirmed cases, the light grays are suspect cases, people that have been admitted to the hospital and we're still waiting testing or something like that. So most of the people are lab confirmed. But we see these big waves happening, and we can see the number of people hospitalized at the end of 2021 was much higher than previously we saw in the year. In Southern Nevada, it kind of pushed us up to the edge of the capacity of our hospitals. Yes, healthcare workers were burned out and all that. I mean the actual capacity where we had to turn people away or we couldn't provide care. We didn't reach that point in Southern Nevada. We managed to stay below that and didn't have to worry about those crisis standards of care. In Northern Nevada, it came much closer. They got right to the edge where we were having those discussions about implementing the crisis standards of care and what happens if you have 12 ventilators and 15 people need it. How do you decide who gets the ventilator first, and making those very difficult decisions. Luckily, we didn't get to that point. We stopped as just short of it. We got to it as close as we could, but we didn't have to reach that point. But this is an important thing for us to understand, the capacity of our healthcare system, because if we're unable to treat those patients, we will obviously see a giant spike in deaths because people that need care won't be able to receive it. And that's another data point that people are very interested in following. We report the deaths out every single day. For me, the deaths aren't that interesting to follow day over day because it doesn't tell us what's happening now. It could be weeks to months between when a person's infected until when they actually die from the disease. So it doesn't tell us anything about today's risk. Even if there's a spike in deaths today, it doesn't mean that happened now. And these are people that were infected long ago over a spread out period of time. So we're very interested in the overall deaths. Obviously, we want to prevent these in the first place, but as a data point to track where we are today in the pandemic, it is not a very useful point. And that's why we look at the deaths. We kind of look at the total number of deaths and look at death rates and some things like that. We also have to think about who is being infected. Older people have a higher death rate than younger people, and so that's going to play into it as well. When we compare state to state, states with an older population would have a higher death rate from it than others. We saw this earlier in the pandemic where Italy had very high death rates because they have the second oldest population on the planet. It's really just a factor of the demographics, and that's something we have to consider when looking at the data. So for me, the deaths aren't really that useful to track day over day. We've seen a pretty flat rate in our death rates by age group since the beginning of the pandemic. We haven't really seen any major changes in that. Death still is something that can happen as one of these, as a COVID infection, but tracking it day over day really isn't that useful to understand where we're at right now. So the demographics are another thing that we look at to really understand how this is affecting our population. And this is the part where some things get counterintuitive. Just because one group has the highest rate of disease doesn't mean they actually are the one that's most affected by this particular infection. So this is a chart from the Southern Nevada Health District looking at the most recent numbers on who is being infected by age. And you can see the groups that are have the highest rate right now, the purple and the green on the chart, are 25 to 49 and 18 to 24. That's the population that's been driving the pandemic lately, and for most of the pandemic have had the highest rates. Now, they don't have the highest death rates or hospitalization rates, but they're the ones that are keeping this infection spreading in the community. We also see lower vaccination rates in this population, so that adds to that problem. When we look at how this affects universities, we have a great example here in Nevada. UNR reported that 1 out of every 9 cases that was being seen in Washoe County was tied to the university. It was students coming together, spending a lot of time in close contact. And this is the same thing we saw all over the country when we had residential campuses. Those younger populations were the groups that were driving the pandemic in the community. They weren't seeing a lot of deaths or hospitalizations as a result of them being younger, but they provided a way to keep that infection going in the community, infect older people, and we would see hospitalizations and deaths in them. The youngest group that we see in this chart is the 0 to 4 age group, and that's been true this entire pandemic. The youngest people have rare disease, and when they do wind up being infected, it usually isn't very serious, doesn't typically require hospitalization, and very rarely results in death. So we see these differences by age group, and we track these over time to see if the disease is changing in our population, and we need to do something different. On UNLV's campus, we would track these sort of things as well. The cases that we saw here, because we're not a residential campus, really mirrored the community, and our rates were a bit lower than what we would actually expect to see. So on campus, by having everybody attend classes remotely, we were able to keep the numbers down here, but it's not the same thing that happened in other parts of the country where people were on the residential campuses. So that's something we have to look at to really understand what's special about each community. The way things spread in Las Vegas isn't going to be the same that they spread in Elko or in Reno, and so we have to keep those things in mind and pay attention to the demographics of who's being infected. If we look at the cases by race and ethnicity, we can see that the highest case rate was in the Hispanic population. Black, Asian Pacific Islander had a slightly higher rate than the white population, and then the Native American population was lower according to this chart. But as I said earlier, that doesn't necessarily tell the whole story. We know that we've seen massive outbreaks on, for example, the Navajo Reservation in New Mexico, and so we have different populations that are affected differently, and the reason we see lower rates in some of them are because of lack of access to care and testing. And so early on in our pandemic, if you looked at Southern Nevada, the places that had the highest rates of disease were those in the wealthiest areas of town. Not because they had more disease, but they had more disease identified because they had easy access to health care. And so those are things that we have to keep in mind. It's not just the numbers that we're seeing, but we have to think about who is going in to be tested and ultimately result in those numbers. And that can be very, very misleading. If we look at the death rate, we see quite a different picture. The Hispanic population has a lower death rate. And then we see a much higher death rate in the Asian and Pacific Islander community. When they did that investigation in Los Angeles, they found that it was the Pacific Islander community that had very high rates. The Asian population tended to be very low, but the Pacific Islander population was a group that was disproportionately affected, and I would expect that the same is true here. But those are the kind of things that we look into to try and understand what's happening. Are there certain segments of our community that need additional testing, additional care, or a focus on vaccination or something like that? So with all of this background, the question is, where are we going? What's next for COVID in Southern Nevada and around the country? This is a chart I showed earlier with our percent positive, and we can clearly see that we've had 3 waves. The first wave was the one that started this all when we had our initial lockdowns, and the numbers were actually pretty high when it came to percentages, but pretty low in terms of total number of cases. Starting about late May, early June of last year, we saw a second wave come through Nevada, and we saw the same thing kind of nationwide. Numbers started to drop down. Beginning of school, the numbers were low, and then by late September, early October, they started to increase again, going into the really high peak that we saw at the end of the year. Things came down starting really about the first of the year, and they continued to drop until we got into late February, early March, and then things kind of leveled off. And so now we're kind of in this fourth phase of the pandemic where we have rates that are kind of bouncing around 5%. And the reason the 5% target is important is this is what the World Health Organization has said is the target to say things are under control. If you have under 5% in test positivity, that means you're not having a lot of cases, and you're also testing a lot of people who aren't positive, which means you're able to conduct surveillance community-wide to try and identify the disease. So you're doing a much better job finding it, and when you're looking for it, it's not really there. So we've been bouncing around that 5% number for a good amount of time now. We've seen a little spike over the last couple weeks or so, but it's hard to say exactly what that means. We have to give it more time till it really makes it clear what's going on. We see little ups and downs from day to day. It really doesn't mean that we're hitting that fourth wave or anything like that. As to where this is going to go into the fall, that's really the big question. How is this going to spread? What's going to happen next? We've seen the Delta variant spread things, or spread more easily, and so that plays into it. But we also have people getting vaccinated, which is going to help control things. So even though we might see an increase in our cases in the fall, it won't be the same type of increase that we saw earlier in the year because the vaccine really changes everything. You can see we had these patterns were pretty consistent over the 3 waves until we got to this most recent one where vaccination was part of it. And so we're at the point now where we basically have things under control, but we need to continue to vaccinate people as these new variants arise to ensure that things don't get out of control. Now, when it comes to vaccinations, this is some of the most recent data from our state. It's a couple days old, but it's very close. And one of the things we talk about is having roughly 51% of our population 12 and older that has initiated vaccination as a mark of how well we're reaching our target population. We can't vaccinate people under 12, so that's why they're not included in this calculation, but they are included in our population. So for me, this is the number that's much more interesting. Roughly 36%, 1/3 of our population, has been fully vaccinated against COVID. So even though we've started vaccinating more people, we only have 1/3 of our population that is protected now against COVID. And that's important because we need to talk about herd immunity. The last thing I want to talk about is what herd immunity actually is, what it means, and a lot of the misconceptions with it. So when you have an infected person, that person on average can infect about 3 other people. It's somewhere between 2.5 and 3, and with the new variants that we've seen more spread than before. So some of the earlier numbers put it about 2.5, which means an average person infected with the virus will infect 2.5 other people. But for simplicity and with those new strains, let's just make it 3. And that's the basic reproductive number. And so this number has been used a lot where people put it in the news and say, oh, this is the number of the virus. Well, so this tells us 3 people on average are infected. Those 3 people go on to infect 3 more people and so on and so forth. And that's how you get those big increases like we've seen over the course of the pandemic. If you start to vaccinate people, it can't spread as easily. And so if we vaccinate 2/3 of the people, this means that the outbreak basically can't sustain itself, because not only are we stopping it from that initial person spreading it, they didn't infect anybody, and those people can no longer infect somebody else. And so if we vaccinate 2/3 of our people, we are basically able to say each person only replaces themselves with an infected person, which means the outbreak is going to remain stable or decrease if we can get that to less than 1. So this is what our target is. When we talk about herd immunity, this is where that number of the target actually comes from. We're trying to make it so that each person doesn't replace themselves with a new infected person. And so that makes the effective R of 1. So R0 can't change, it's a characteristic of the disease. But we have an effective R of 1, which means each person just replaces themselves, and that keeps things from spreading. The problem, though, is we only have 1/3 of our population vaccinated. So if we look at it, that gives us an effective R about 2. Right now, each person is on average infecting 2 other people, which still allows the disease to spread and allows us to have transmission. And so this is the challenge we're at right now, trying to get from that 1/3 of our population being fully vaccinated. And with people under 12 not being able to be vaccinated, that adds some challenge to it as well. Hopefully that will come around later this year where they can get vaccinated. But right now, there's a segment of our population that just is unable to be vaccinated. And the last thing to think about with herd immunity, people think of it as soon as we reach this level of herd immunity, our population is fully protected, disease goes away. That's not really the case, because that relies on every person in the population mixing like animals in a field. That's where the term would come from. Every person has an equal chance of contacting somebody else in southern Nevada, and we know that's not the case. So even once we've reached herd immunity, if the vaccinated people all hang out together and the unvaccinated people all hang out together, you have one population that's going to be left alone and another one that's still going to see a lot of outbreaks and a lot of transmission in the community. So even though our targets are there for that roughly 2/3 of the population to be vaccinated, that doesn't mean everything's going to go away. It means we're going to have things under control. It'll keep us from being able to stop large outbreaks in the community, but we'll still see transmission from time to time. We'll still see clusters of disease, and that will require ongoing attention even once we reach that level of herd immunity in our community. So the last thing to mention is this is where we're at right now, and nobody can really predict what's going to happen in the fall. We have all these things that come into play that may keep things under control, but that is really the big question of exactly how this is going to play out in the fall.
Well, thank you, Dr. Labus. We had some questions come in from our audience while you're giving your presentation. The first one is, how likely are we to have a 4th wave of infections this winter?
We are still going to see transmission of disease throughout this fall and winter. The question is it going to be a wave like we've seen before? We know there's going to be ongoing disease. It'll probably look very different than the previous waves just because of adding vaccination to the mix. But at the same time, we've also gotten rid of face masking in general. Even though 2/3 of the population is not vaccinated, I would say way more than 2/3 of the population is not wearing masks now. So we know that people aren't necessarily following the rules, and all those things will affect the pattern of disease into the fall. We're still going to see transmission. What that wave looks like is really going to be the question.
Interesting. Another question that came in was, how dangerous is the Delta variant? I know that's been in the news a lot these days.
So what we've seen with the Delta variant so far is that it spreads more easily. That's the big difference between Delta and the previous strains that we've seen. We haven't seen that it causes higher rates of hospitalization or death or anything like that. There's the potential that the vaccine could be less effective against it, but what we've seen so far is that the vaccine still does work against any of the variants. So the real concern is that it spreads more easily, which makes it more challenging for us to reach herd immunity because we're fighting essentially a stronger adversary.
Interesting, okay. Next question that came in while you were speaking was, how long do you think the vaccine will protect us? Do you think we will need a booster, and when? I know there's a lot of conversation in the news about booster shots and everything. Can you elaborate on that?
So right now, I think the real answer is we don't know. We know that the vaccine provides protection for probably at least a year. The question is what happens after that? How soon does the vaccine protection wear off? We know that natural infection can wear off rather quickly, but the vaccine seems to provide protection that lasts for some extended period of time. We just don't know until we've experienced that additional time if it wears off quickly and when a subsequent booster dose would be needed. We also have to look at what variants are out there. If the vaccine doesn't protect as well against the strains that are the dominant circulating ones, and I would expect the Delta to be the dominant strain this fall, we'll probably need to change up the vaccine and make it as a potential booster dose. But I don't think anybody looks at this as a thing that we're going to need as an annual shot. I would think of it more like your tetanus shot. You get one of those every 10 years. It'll be something like that where if it does wear off, it'll be a longer period between booster doses.
Well, that sounds like good news. And then I guess one final question that came in here. Do you think combining vaccinations will work? And then part B of this is, what is your opinion about combining different vaccine brands? Should we be worried about that? Or if we got Pfizer or Moderna, should we stick to just Pfizer or Moderna?
Well, all the testing we've done is based on getting the same vaccine. So if you got your first dose is Pfizer, your second dose should be Pfizer. Same with Moderna. When we start to add booster doses and things like that, that's going to change things up a bit because we're going to start to study what happens if we need a Pfizer booster dose after you got the Moderna original shot. It really comes down to the fact that we haven't tested to see what happens when you mix and match vaccines. It's very likely that one vaccine and the other vaccine will be interchangeable if they're the same type, for example, the mRNA vaccines. We just don't know that because we don't have a lot of studies on that. We've stayed with the same vaccine that has gone through the trials. At some point, though, it's likely that we'll have kind of the ability to mix and match vaccines because that's what we do for every other vaccine that's out there. If you get a measles shot, your booster dose doesn't have to be the same brand or anything like that. So likely we'll see that change in the future. But right now, because we haven't tested it and can show that it is effective to mix and match the doses, we haven't been able to do it. But I would expect over time that's likely to occur.
Well, I said that was the final question, but now we're getting more questions, which is good because we've got you here. So we're glad the questions are coming in. What's the role of infection and antibodies in herd immunity? Can you elaborate on that?
So herd immunity basically comes down to three things. It comes down to the number of people you have contact with, the probability of transmission during each contact, and the duration of time that you're sick. We can't change the duration of your illness. We can change the number of people that you come in contact with through isolation and quarantine. So that other piece of transmission is where the antibodies come into play. So if we have populations that are immune, the probability of transmission is going to be 0. And that's really what we're trying to get to. We want people to have no likelihood of getting disease even if they're exposed, because then that's going to prevent them from being infected and spreading it onto other people. So that's why we're so focused on vaccination. It provides a huge segment of our community that can't be immunized, essentially knocks that piece out by them being immune, and it breaks that chain of transmission.
Well, since we're talking about herd immunity, and we got another question here, can you talk a little bit about unvaccinated tourists coming to Las Vegas, and does that impact our ability to achieve herd immunity?
This is one of my favorite things to talk about, actually, when it comes to our populations. The tourist population and the resident population are quite split up when it comes to disease transmission. And the reason I say this is the average tourist stays 3.5 nights in Las Vegas. It takes up to 2 weeks for you to get disease. So if you get infected the minute you get off the plane, you're probably not going to be infectious until you're already going home or are already home. And so we have a lot of turnover in our community, and this happens for all sorts of diseases. Anything with a slightly longer incubation period isn't going to be a problem in Southern Nevada. It's going to be a problem where those people came from. So if they get infected on the Strip during their trip, they're going to take it home, and that's where they're going to spread it. It's not going to amplify in Southern Nevada. From the casinos, we've seen that their immunization rates have been really high. Some places have over 90% of their workers vaccinated, and those who aren't vaccinated still have to wear masks and make sure they don't get infected by that tourist population.
Mm-hmm.
So there's this kind of cushion around the tourist population that keeps disease really from spreading too much into our population. They're not completely isolated, obviously, but that's why we don't see big outbreaks of disease in the tourist corridor or in our population that works on the Strip. It's basically the idea that people go home before they can spread disease, and that's why Vegas's disease patterns look just like everywhere else in the country.
Mm-hmm. So we got another one come in. We're on a roll with these questions. So has wastewater testing been useful in being able to predict the pattern of COVID in our population?
We've been doing wastewater testing here and around the country. It has benefit to understand what's out there. You can start to detect variants in the population before you may do that at an individual level. So there is some benefit to it. It's something new, though, that we haven't been doing for a long time, so it's hard to figure out exactly how it fits in and what all those different positives mean. Something we're obviously very interested in, but you're looking at basically the community, which is what we want to do in public health, and you can get a much better sample of the entire community looking at wastewater, because all our wastewater mixes together. So if there are new variants out there that may be at a very low level, we can find those in the wastewater when we might not be able to yet through individual laboratory testing.
Great. I think that's it. Well, thank you everyone watching for your questions today. And I want to again thank Dr. Brian Labus for that informative presentation and for answering questions from our audience. Now, let me introduce someone you likely already know very well, Dr. Stephen Miller, who will be continuing to lead research here at CBER, as well as an esteemed professor at the Department of Economics at the UNLV Lee Business School. Not to mention, he's also the former chair of the board of directors of the Las Vegas Economic Club and former director of economics chair of economics in the Lee Business School. Dr. Miller is here to give us a presentation on the economic side of the coin and what we can expect going forward now that Dr. Labus has explained the health side. Thank you for Professor Miller for being here.
Thank you, Andrew, for that kind introduction. So good morning, Las Vegas. Good morning, Nevada. Good morning, world. We might have people looking at this from other places in this world. So this morning I'm pleased to say that we're going to talk about an update on the forecast from December. And my task is to talk about the national economy, the Nevada economy, and the Southern Nevada economy all in a very short period of time, which I probably will fail to do. I'll probably run over. But be assured, if you're attending this conference, that electronically you're going to receive a publication, a report that is much longer and goes into more detail than I'm going to be able to do in my presentation. So let's get at it. Starting with the national outlook. This time is different. It's not like your ordinary recession. It's not that the Federal Reserve took away the punch bowl and the economy slowly went into recession. No. This was a COVID recession, a pandemic, and the government shut the economy down. And it happened so quickly, we lost more employment in Las Vegas in 2 months than we had gained since the end of the Great Recession to February of 2020. It was an amazing event. So it was a government-imposed lockdown, and the analysts tell us it's a 100-year event. The pandemic is a 100-year event. Well, I hope it is. Not that it couldn't happen next year, it could. But the averages tell us it's a 100-year event. I wanted to point out that construction activity for Las Vegas was considered an essential activity. Looking at the fiscal side of the house at the national level, the CARES Act and all the follow-up legislation, that was an amazing event that if you looked at it from the political point of view, say, did they really do that? Actually, the one-time checks, the extra unemployment insurance, the lending to small businesses, all those activities aided in the relief to those people that were thrown out of work, the businesses that had to shut down, so on and so forth. It was an amazing activity and very crucial for the local economy. So the first chart I'm looking at looks at the real GDP growth. There are several series on this chart. The black bars represent the growth rate in what's called potential output. This is something that's calculated by the Congressional Budget Office. Potential output measures what the economy can do sort of year in and year out over the long run, and not have the economy overheat and not have resources idle in the economy. That is, the economy is not too hot, it's not too cold, it's just right. You might call it the Goldilocks economy. If you look at that chart, you see that in 2020 we had a whipsaw of the economy. That is, we had huge losses in the first 2 quarters and huge gains in the second 2 quarters. If you just look at the number, the picture, you say to yourself, it looks like that they offset each other. No, because the growth in the third and fourth quarters was on a much lower base. So the same percentage growth on a lower base yields a much smaller number in total. The red bars represent the CBER's forecast. The blue bars represent the actual numbers that occurred. So what we're forecasting off into the future, 21, 22, is a growth rate that exceeds the potential growth rate. So we should catch up and move back to potential. In fact, we're predicting a return to potential in the third quarter of 2022. I think that our forecast is a little bit conservative. Others are forecasting a more rapid return. Another way of looking at this data is to look at the levels. So the black line is potential, the red line is actual data, and up there in the far left right-hand corner, when you see the pitchfork with the dotted black line, the dotted red line is our forecast, and the dotted black line represents the 95% confidence range around our forecast. I should note that the gray bars represent recession. So the third bar from the left represents the Great Recession, which, if you look at the red line, you see that there was a big drop and it lasted for a long period of time until we got back to potential. You compare that to the COVID recession. The COVID recession, you fell dramatically. We recovered quickly, and eventually we're going to get back there pretty quickly to potential. What about monetary policy? The Federal Reserve is controlling the federal funds rate, which is the red line here. We also show the 10-year Treasury rate, the black line, and the 30-year conventional mortgage rate, which is the blue line. You look at the red line out at the bottom on the right, you see that the Fed was preaching the story that they're going to hold their fire until it's absolutely necessary. And they're going to hold interest rates at 0 through the end of 2024. Well, within the last week or so, they changed their tune a little bit, and now they're saying 2 interest rate increases by the end of 2023. And then Bullard from the St. Louis Fed, the president there, came out and added his opinion, which is one of those is going to be before the end of 2022. So I think that the Fed is slowly reevaluating their position on monetary policy. We're going to come back to that in just a second. Here's a look at the world level. We've divided the world economies up into sectors. So we have the Asia Pacific region, the emerging markets, the advanced economies, and the world economy. The world is represented by the red line. The advanced economies are the black line. Let me focus on that. The black line, you'll notice, before the 2020 downturn was around 2%, under 2%, and it's returned. It was forecast to return to that once we have the drop in the spike up in 2021. These are IMF forecasts. We notice in 2020 that all regions are simultaneously recording negative growth. The only country that had positive growth, interestingly enough, was the site of the emergence of the pandemic, and that's China. So we conduct a quarterly survey of businesses, and this is the results from the March survey. The June survey, we just buttoned up the results, and we're working on writing the report. Should be out after July 4th. This asks the question, when do you expect full recovery from the current recession? And you can see there 57% of the respondents said 2023 or later. My expectation is that those numbers are going to move a little closer to the present. We'll have to see. We also asked the respondents what they felt about fiscal and monetary policy. How were the federal authorities doing on that? So this is the answer to fiscal policy. You notice there's a 20% 28.2% are saying that the fiscal policy was just about right, but sort of evenly, almost evenly distributed, too much or too little on both sides of the just about right. You might call this a uniform distribution with a sort of a boost a bit to the just about right. This is fiscal policy. On monetary policy, it's even a stronger uniform distribution above and below, too strong and too weak. And it's 43% are saying just about right. So the latest thing that's hit the news is the inflation rate. This is a picture of the core PCE inflation rate. That's the variable that the Fed is following when they make their decisions. Last week, the core CPI inflation rate came out, and it jumped up in May by, I think, about 5%. This was the April number for the core PCE. It went up 3.1%. I think that the latest data on May are going to come out in a few days. We'll have to see if it matches the CPI about 5%. The real issue here, however, for the Fed is this a temporary event or a permanent event? I sort of side with the Fed in saying it's a temporary event. What happened during the pandemic is you had a huge decline in demand for 2 months, and then a recovery, increasing in demand, and then a pause. We're going to talk about this in some detail for Nevada. And then last 2 months, March and April of 2021, we've had a surge in demand again. And what's happening is the supply chain, in order to feed that demand, has to adjust. And it can't adjust immediately. It takes some time to work its way through the supply chain. So huge drop in demand and then a huge increase in demand, that's going to affect the supply chain. And so there's a shortage in some markets, and that's driving prices up. And if you're following the press, you know the business press, that the commodity prices are easing a bit. Lumber prices are coming down. Good news for the construction sector. We may get a question about that later, I'm guessing. Okay, Nevada outlook. I'm going to spend just a brief amount of time looking at Nevada. CBER publishes the coincident index, which includes taxable sales, non-farm employment, and gross gaming revenue. We take those three series, we seasonally adjust it, and then we normalize the variability so that all three series have the same variability, and then we put them in the pot, stir it nicely, and pull out the index. The idea is so that no one series dominates the index. Go to the far right end of the chart. You look at that and say, well, what the heck is that? So it peaked for most of the series in Nevada, Southern Nevada, the peak was February 2020. Then there was a huge drop. And you went down March, April. You see it there, March, April. So that very thin gray line is the recession. It's 2 months. And then there's a recovery that pops up March, April down, May and June up, and then July through February of 2022, sort of a pause. The pause that refreshes. No, I don't think it was refreshing. There was a pause. And then March and April of 2022, boom, it's jumping up again. So, partner, you come to the CBER ranch, our cattle ranch. How are we going to brand this recession? Well, I'm branding it as the broken V. I know some people say a V recession, a W recession, and some wag said there's 28 letters in the alphabet, so you choose your letter. Well, I'm going to choose the V, but it's broken V. It's popped to the right before it finishes the upward movement. Now, is it going to continue to go up? I think it probably will. I predict that the May and June numbers, when they come out, they're going to be positive. The signals are there. It's going to be that way. So now we're talking now about Nevada. The same thing holds for Southern Nevada. So you with me? That's a broken V. Okay, here's employment. The numbers came out yesterday, so I don't have it in the chart. They said they added 10,000 jobs in Nevada. And you look at this line, it's not the broken V yet. It looks a little bit more like the Nike swoosh. Well, I don't know about the Nike swoosh. You go down and up. Okay. But it's not yet the broken V. And if I add 10,000 on that, the line's going to continue moving in the same direction. Well, if I'm honest about it, and I'm going to be honest, it's up a little bit higher slope, but not much. Okay, but employment is our problem. I think I'll get a question about employment later if you guys are paying attention. I tell my students, you learn something every day if you pay attention and don't fall asleep. So if you're not asleep, you're probably going to ask a question. Here's the unemployment rate for Nevada, and it popped down to 7.8%. It's not in this chart. The interesting thing about unemployment is they've had trouble measuring it. I mean, it gets a lot of discussion in any event, but during the pandemic, measuring has been a problem. So every time they come out with a new update, a new month is added, though some of the other series points are changed as well. So if you look at a flip chart of this going back in time, it would be moving. Be a moving picture. So the Nevada forecast, we forecast out to 2022, and if you look at the forecast, you see the visitor volume, gross gaming revenue, and the employment have a pattern. In 2020, boom, they collapse. 2021, they expand. And then 2022, they expand again, but not so much. A little bit softer expansion. And the unemployment rate's the reverse. The unemployment rate increases a lot, then it falls down, and then it comes back again in 2022, but not as much. And personal income and population have a mind of their own. They're all positive. Population is something that we're concerned about here in Southern Nevada, but this is the Nevada numbers. So the population numbers are all positive, just under 2% in 2022. Okay, so how about the Southern Nevada outlook? So we also produce, well, I'm one slide ahead of myself. So the pandemic effects on the Southern Nevada economy. So I like to view the Southern Nevada economy as having two sectors. So we have a sector over here where you have to meet face to face. Call it the gather together sector. So restaurants and bars and casinos and doctors and dentists, sports entertainment, playing hockey in an empty T-Mobile Arena is not so exciting. But if you got 18,000 plus fans there screaming and yelling, it's a different experience. But when the pandemic hit, that affected the gather together sectors. And Las Vegas Metro is exposed significantly to gathering together sectors. We have a lot of them. And because of that, our economic recovery is really tied at the hip, as Andrew said earlier in his introduction, to the recovering from COVID-19. And I appreciate Brian's comments, but I have this nagging concern about a resurgence. I know he was pretty positive, but he said we could have a surge because of the vaccination level. So here's the coincidence index for Southern Nevada. It's the same story, the same three variables. We seasonally adjust them, and we normalize the volatility. We put them in the pot, stir it up, we pull out the index. And this measures the contemporaneous economy. Once again, the gray bars are the recessions, but note that what the recessions are here, they peak to trough in the local economy. So these are the recessions for Southern Nevada. I forgot to say that in the Nevada coincidence index, those are the recessions for Nevada, not for the U.S. or for Southern Nevada. We see the same picture, the broken V. It's coming back. Here's the employment. Same story as Nevada. Of course, Southern Nevada is 75% of the Nevada economy. I'm sorry, but Reno is only like 15%, at least in economics. In terms of politics, it may be a different story, but in terms of economics, it's only 15%. Here's taxable sales. Taxable sales is the only series I'm going to show you that has gone past its previous peak. So broken V, and it's doing quite well. I'm really interested to see what the May and June numbers. Unfortunately, taxable sales, because of various reasons, it has a longer lag than the other series. It always comes out later than the other series. Here's gross gaming revenue. Quite a volatile series, even after we've seasonally adjusted it. Notice that the origin is 0 and the fall was almost down to 0 and recovered quite smartly. Once again, that's February is the peak. I'm looking at, so March, April, all the way to 0 almost. May, June, pop back up, pause, that refreshes. And then boom, a recovery again. And I remember the headline when that first number came out with a pop way up in gross gaming revenue. Here's what was I looking at? I'm sorry, did I say gross gaming? It is gross gaming revenue, I'm sorry. So here's the unemployment rate for Las Vegas. It's sort of swinging sideways here. We'd like to see it come down more, but that may take some more time. Here's a tourism index, which combines the hotel motel occupancy rate, gross gaming revenue, and McCarran passengers into one side. Once again, we take those series, we seasonally adjust them, we normalize the volatility, throw it into the pot, stir it up, pull it out. It's a broken V. Now, if you're looking at it carefully, you say, no, Miller, that's a walking W. I can see it. It's going up the stairs. Notice that the tourism index sort of popped, it went down, it came back up, it was pausing. Then it looked like it was going to go south again. I was concerned that we might see a double dip recession, but we didn't. It's popped back up. We're going to see that again. So here's McCarran passengers. Now, the thing to notice here, so 0 is on the eye. So once again, pop down to 0. McCarran passengers are lagging behind the other variables in terms of the performance. Once again, broken V. Here's the occupancy rate, broken V. But look, it was a walking W, right? You see that the decline in the end of the year, early in 2022. And here's visitor volume, same story. It's getting repetitious. I'm sorry, but the story is the same. The real issue of what's going to happen with May and June numbers. Except when you go to construction, because remember I said construction was viewed as an essential activity. So here's the construction index. Once again, 3 series: commercial permits, residential permits, and construction employment. Seasonally adjust, normalize the volatility, throw it in the pot, stir it up, pull it out. Here's the index. The COVID recession didn't seem to affect it much. Here's the employment. We see it coming down. I attribute that more to the completion of big projects like Allegiant Stadium and Resorts World than to the COVID, because they just continue working. Okay, I'm almost done here. Almost on time too. Go figure. And here's the Case-Shiller home price index. The point to make here is that Las Vegas is the red line, Phoenix is the green line. Las Vegas and Phoenix are sort of trailing the pack. These are western metro areas. The leader is Los Angeles. Now it's all normalized to January of 2000. January 2000, is it January 2000? Let me take a look. Yeah, January 2000 is the normalization. If I change the normalization, I may jigger the charts around. But we see that Las Vegas and Phoenix are at the bottom of the pack. In fact, Phoenix has now separated itself from Las Vegas. So when you hear about how bad Las Vegas is in home prices, it can be worse. Maybe that's not comforting, but it could be worse. If you're a homeowner, you'd like to be in Los Angeles maybe. You retire, sell your home, take out your equity, come to Vegas, buy a house, live like a king or queen. Sorry, I shouldn't be moving around. Here's the commercial vacancy rates for retail, industrial, and office market. Now, if I look at this, I say the office market may have been affected, but that may not be a big surprise. We weren't going to the office, right? Thank God for Zoom. right? Do you like Zoom? Are you getting tired of Zoom? My take on this whole story about how we're all going to be working from home, I don't believe it. I think that we're social animals. We like to interact, and people are going to go back and meet face to face, even if they don't have to. We'll still do things by Zoom. There are certain things that are officially done that way, but you don't get the social interaction that you'd like. Okay, so what was the most important challenge as a business that you faced? Interestingly enough, it was economic uncertainty. It wasn't COVID. This was March of this year. We'll get new numbers soon. COVID came in second, and then finding qualified employees, which for the longest time was the number one answer, now is in third place. Well, it's really fourth place behind a bunch of people answer other. They fill in the blank, and there's 14% were other answers. Southern Nevada forecast. It's very similar to the Nevada forecast. We added a couple of series. So the visitor volume, gross gaming revenue, hotel, motel occupancy, and it's employment, all have the same pattern. Huge decreases in 2020, huge recovery in 2021, and another recovery, but not so large in 2022. And then the unemployment rate reverses that. And we see that personal income and population are all positive. And we see a 2.2% growth rate in population in 2022. So I should also acknowledge the forecast team of Professor Canarella and Miss Lee, who slave over the numbers to come up with the forecast that I report. I think that's it. Knowledge within reach. That's CBER.
Well, thank you, Professor Miller.
I think I gave these people a hard time.
Well, they're professionals.
Yes.
Well, we got some questions from the audience while you were presenting, so I want to make sure we get these answered. Certainly this has been in the news, and we've heard a lot about it. Can you talk a little about the shortages we're hearing about? You mentioned lumber, but both on the demand side, the supply side, what does this mean for the economy? I know right now a lot of employers we're hearing are having a hard time finding people to come in and work, but we're also hearing too that people want to take their time.
Yeah, so let's talk about employment. So it's a free market that we live in, so that subject to regulation by government, of course. So the issue there is you have a demand side and supply side. On the supply side, we have people who are maybe looking for work or not looking for work. Are they in the labor force, not in the labor force? And so one of the reasons offered about why firms are not finding people is that they're getting extra unemployment benefits, and they're just staying home. Well, the extra unemployment benefits indeed supplement their income and allow them to search for employment. Take longer to search. They may say, I might find a better job at a higher wage. I worked in the restaurant industry, and I'd like to get out of that business. I want to move into some other, maybe warehousing and distribution. So they may be looking to change their career path. But we also know because of COVID, people may have been home not because of the benefits, but because they had children that were attending school from home. Or they may have had parents that were at home that needed to be taken care of. Or maybe they were afraid if they went to work, they'd catch the disease. And they didn't want to catch the disease. If they may end up in the hospital or on a ventilator, and they may die. So there's all kinds of reasons on the supply side. But from my point of view, the real issue is on the demand side, because what happened was the government came in with all these restrictions. So in Nevada, Governor Sisolak and his advisory board, if you look at the time frame I looked at when I was looking at my broken V, you looked at all the not legislation, but the edicts coming out of the governor's office. They matched up pretty perfectly with the movement in the economic cycle. That is, the regulation by the government affected the movement in the economic cycle. So that people are, and in the most recent months, we've had a surge in demand. So what's happened is we moved to 100%, so we have all the restaurants, all the bars, the spas, the healthcare, everybody's coming looking for employment now. So it's all synchronized. And the problem is it's going to take the market some time to work that out. There's a structural issue because the people on the supply side need to decide to be looking for the jobs that are being offered. And if they're paying attention, they're seeing that wages are going up. People are complaining they can't find people to work. Some people are paying bonuses, others paying higher wages. In my own view, I think bonuses is probably the way to go because the bonus is a one-time payment. It's not going to be permanent in your wage bill anyway. So as I said during my presentation, drop in demand, then an increase in demand, all caused by the pandemic and government regulation, causes weird things to happen in the supply chain for goods and services, intermediate goods and services, and also for resources, including labor.
Okay. Well,
did you understand what I just said? I'm not sure I did.
Yes, I did.
It's complicated.
It's temporary, is what you're kind of saying, right?
Well, I'm on the temporary side. It's a year from now, things will probably have sorted themselves out.
Okay.
Assuming we don't go back into recession because a variant comes in and we have another surge.
You're getting ahead of yourself. That was another question that came.
Can't resist.
Yeah, so that you can elaborate on that because that was another question that came in. Was just, I know Dr. Labus was a little more positive on this, but you said you're a little more. If there is another wave, how do you think it's going to impact our economy?
Well, if there is another wave, it's not going to be good for the economy. It'll slow things down, and it probably will not be as dramatic as the last wave that we got, but it could be a significant effect. And I don't. It's not that I'm wishing for that to happen, of course, but any business any business person who's thinking properly should always keep some powder dry. So this is a very good time, I think, to keep some powder dry.
Okay. Well, with any economist, right? There's always hawks and doves, so it's good to get your thoughts on this. Another question that came in: do you think the current gaming revenue performance will continue after the federal stimulus benefits end? So for our friends in gaming and hospitality.
I think the trend will continue. I think there'll probably be overshooting in the short run. To the extent, and I believe it's the case, to the extent there's been sort of pent-up demand, people have been at home for over a year, not doing the ordinary things. I know I have a cousin who lives in Indianapolis. He comes to Vegas 3 times a year, stays at the same place, does the same thing, loses the same amount of money, goes home, has a good time. But he hasn't been doing that. So if there is pent-up demand for a Vegas vacation, then people are going to come in and there'll be a jump in gaming revenue, but I don't think the jump is sustainable long run. A good portion of it is, but not the total, not the immediate short run effect. Okay.
I think this is our final question. What are your thoughts on the timing of the recovery, in particular to midweek visitor volume? So with our tourists and the conventions, I guess probably what this is getting at is winter conventions coming back, or what's your prediction?
Well, it looks like conventions are coming back. They've had a couple,
yeah,
and the schedule is filling up. God forbid that they would have an event related. Of course, Brian sort of told us that Vegas is the short run stay here is really we shouldn't have an event here, right? To the extent that COVID is caused by a convention, it's going to be hard to discover, except through tracing, I suppose, because it's going to appear elsewhere. No, I think the economy is going to recover, and midweek will come back.
Okay, good. That's good. Well, thank you, Professor Miller, for your presentation and for answering questions from our audience. Our guests today have provided information on 2 topics that we have been reminded matter a great deal: our health and our economy. as you've heard. The path before us is challenging, but when the right questions are asked, full of possibilities. As I laid out my vision at the beginning of CBER, we're here to help, whether it be surveys, forecasts, cost-benefit analysis, business intelligence, or even help thinking through an idea. Let us be your guide for a better tomorrow today. Thank you to our sponsors, gold sponsors, Mitsubishi Cement Corporation and Southwest Gas Foundation, silver sponsors, Colliers, Heck Wealth Management, Velstand Investments, the Venetian Resort, and Cushman and Wakefield, as well as all of our attendees. Thank you for joining us today, and stay tuned for future upcoming events and newsletters. Next month, we'll be launching our weekly newsletter, and starting this fall, we'll be hosting campus conversations with industry leaders and experts on the 12 sectors of Nevada's economy, not to mention our end-of-the-year outlook, which will be in person. For more information, sign up at cber.unlv.edu or give us a call. Thank you for joining us.